Hello, good morning, and welcome. I am excited to be here. I am Nicole Rate with Evergreen Certifications and excited to introduce you all to Kiplee Bell. I'll
Hi,
let you introduce yourself there.
how are you? Good to be with you
Good.
this morning.
Yes, we are excited to talk about the Certified Geriatric Care Professional certification that you helped us develop and that you've got some courses that lead up to that. So we're really excited about this certification for a variety of healthcare professionals.
Absolutely, yes. So on my platform, impactfulcaregiving.com, you have two tracks. You have the Certified Geriatric Professional track. So these are for your licensed clinical advanced prescribers, your nurse practitioners, physician assistants, the like that have prescribing authority to clear out the cobwebs, not only get continuing education credit, but the additional certification that Evergreen provides is says to an entity, hey, I've really taken this time in the geriatric space to niche down and understand this older active adult population. And then we have the informed track, which is for your clinical professional that's supporting the advanced prescriber. So this can look like a certified nursing assistant, a medical assistant, a speech pathologist, respiratory therapist, hospice, etc.
Yes,
So
absolutely. We're so excited to offer this to a wide variety of professionals at both of those levels of care.
yes, absolutely.
All right, well, we'll get started with our first question here so we can jump into this. So why should a professional get certified in geriatric care?
I think, certification is important because it establishes authority. It establishes the need for, continued education for the person to say, listen, I've really drilled down to understand my clinical practice, and I've stayed up to date on evidence-based medicine. And so I think that's what certification does for a provider is you're setting yourself apart not only to satisfy your continuing education credit, but you're also saying, I'm up to date. So when I'm at bedside, I'm giving you the best and the most up to date practice.
Absolutely, yes. It's really important to provide the best care possible.
Absolutely.
Absolutely. All right. So our next question for you. So what is unique about this? That there's a lot of different certifications out there that professionals can go after. So what is unique about Evergreen certification?
I am excited to partner with Evergreen because I teach that caregiving is professional and personal. So although we are clinical providers, we are at bedside with our patients, we also have our own families that we care for at both at the advanced clinical level down to those support staff. And so it's important to bring and merge those two concepts together, that we're not separate from the patient. We are the same. And so we're just taking the time to become more educated in our spaces. So Evergreen certification providing that support and also reinforcing the narrative that yes, I am a personal and a professional caregiver really helps us rewrite the narrative of medicine to say, this is beyond empathy, this is beyond bedside, but I too am caregiving an aging a person. I too understand you, patient, and what you're going through, but I'm able to now also provide the educational support and best data, best clinical practices at bedside. So those two important distinguishing factors of my platform in partnership with Evergreen are very important to me to maintain not only the integrity of practice, but also the up-to-date and evidence-based medicine.
Absolutely. That's so important. That's a really great point that you can't separate who you are always, with work and at home and, providing the best care possible for patients, regardless of everything else that you may be going through.
Absolutely. I mean, we hear so much about caregiver burden and caregiver stress, and throughout COVID, what we collectively endured in the medical space, touted as heroes, but in the challenges that we've all had to collectively rent. But at the end of the day, it's also not forgetting who we are when we get up in the morning and we have families and we signed up to have a helping profession. What does that mean? So yeah, certification is important, but also partnering with Evergreen to say, yes, I see you as a clinician that is personally and professionally caregiving is important.
Absolutely. Yes. Thank you. Our next question for you is, which professions would the certification serve? So I know you kind of touched on this a little bit in the beginning when you were talking about the two different certifications. I don't know if you can kind of go a little bit deeper for us.
Absolutely. So again, there are two tracks when you go to impactfulcaregiving.com. There is the clinical geriatric professional. So these are licensed advanced practitioners, okay? Nurse practitioners, physician assistants, pharmacists, MDs, those who have advanced clinical prescribing authority that need to understand geriatric pharmacology at its core and need to maintain continuing medical education credit. So Evergreen provides this professional platform. The person goes through several modules, tests, etc. Upon completion, I then notify Evergreen that the professional has indeed completed their course, and then they're able to satisfy the professional certificate accordingly. And then the informed geriatric professional says, and this is very key, going back to your earlier question, when we're making a distinction. I oftentimes hear support staff say, well, I'm just a certified nursing assistant, or I'm just a medical assistant, or I'm just an occupational therapist assistant. But every role of the healthcare team has clinical relevance, especially when it comes to the care of the geriatric patient, because that medical who is performing activities of daily living, grooming, ADLs, really has that pulse on what is going on with the patient and can provide cues to the registered nurse, to the nurse practitioner, to the MD to say, you know what, Mary wasn't right herself today. And by the way, as a geriatric informed professional, I learned on my Evergreen certification program that this type of behavior may cue to a drug-to-drug side effect, or a urinary tract infection, or a sudden loss and grief that is now manifesting in a behavioral change. So really partnering with Evergreen in this regard to say, yes, as an informed geriatric professional, your role is valid and establishes yourself as an authority to say, I've taken the extra step to become informed so I can best advocate for my older loved one.
Yeah, absolutely. And I know we had a lot of conversations around that when we were building these certifications, and the importance of providing a certification to all professionals out there to best serve the role that they are, so they can ultimately provide the best care possible for their patient and ensure that, trust and confidence that their patients have in them as well, that they know that the provider, regardless of who they are, is giving them the best care possible.
Absolutely. Absolutely.
All right. So where can some of these certified professionals work? Are they limited to just like nursing homes, or are there, a variety of capacities, or where would you find the certified geriatric care professional working?
Oh, so this is pretty cool now, because what we're seeing is the trend that the future of healthcare is at home. So we have hospital at home, where we have hospitalist, inpatient, admitted, older active adults that transition to the home environment, and their care is provided hospital at home with all of the same kind of systems in place. So it can look like a field program. It can look like an informed professional who now a caregiver has now hired this informed professional to come in and caregive for their older loved ones. Yes, it looks like skilled nursing facilities, assisted living facilities, independent living, memory care units, hospital-based systems, group homes, many different scenarios of these practitioners across many different types of facilities. But now again, we're seeing the trend of caregiving and the future of remote health. So the importance of having a geriatric informed decision making becomes paramount.
Absolutely. And, and that's a really great point too, that if a family is looking for a caregiver for their loved one who is at home but needs that extra care, that this certification also provides another opportunity for that family member to say, okay, you know what, I know this person has taken that extra step, and they have that certified, credential behind their name.
Absolutely. Because at the end of the day, we are in, we have kind of skirted this, seesaw of, okay, we want the credential, we want to establish ourselves as educated professional persons, we have our degrees, but what is the work that we're doing? We're seeing this trend of TikTok and Instagram and YouTube of layman people kind of taking to the streets to do the work, because they haven't quite found what they're looking for, and have maybe stumbled upon a narrative that wasn't supportive for them or their families. So this is kind of what I've mentioned on prior lectures is hashtag take our Google back, where we say, yeah, we are trained, we see you, we are clinically here and fully present for you and your family. We are personal and professional caregiving, and we have armed ourselves with the tools and educational acumen to serve best clinical practices.
Absolutely. I love that hashtag take your Google back. That's really great. All right. I think we have one last question for you here. So I guess we kind of maybe answered this a little bit already, but where is the need for these certified professionals? So I know we talked a little bit about where they are. Is there anywhere where there is more of a need for people who have this certification?
I think, it's interesting. It's an interesting point in that when I think about why I started Impactful Caregiving, I created these modules initially for the layman caregiver, because I found time and time again at the bedside, families and patients exasperated and trying to navigate the healthcare space, and it left them powerless in terms of advocating for their loved one. And then, midstream, I realized, what, the average caregiver really is inundated with the caregiver task, the day-to-day task, let alone to listen to me for an hour, right, per module. But again, caregivers still seek education, and applied education is power. It's the power to transform your family, to transform your care. And I think what makes me most authentic in my space is I'm caregiving for an 87-year-old mother. So every day when I'm teaching geriatric pharmacology, I can speak to drug-to-drug side effects and behavioral change, and what that looks like in real time, what that looks like from my own mother, which can't be any more authentic than that. And so I think that's important for us to be transparent in the spaces that we are. So the certification becomes universal. It's a universal need, whether it be remote, as what we're doing here, peer to peer, colleague to colleague, bedside to professional, professional to professional, to say, hey, Nurse Ratchet, I see what you're going through today. You know what? Pass this patient on. Let me pick up your patient. I know that you're going through a certain ordeal at home, and this can impose on your professional care. So seeing each other, realizing that we're all kind of going through different challenges. Everybody has a thing, but recognizing that taking the time to be educated will save a lot of angst and stress in the long run as well.
Absolutely. Yeah. Just getting that education out there, and, people having that confidence that, okay, I've gone through and gotten certified, and so I have the knowledge, I can do this, and I can share and help more people. Absolutely.
Absolutely.
Yes. Well, thank you so much for joining us today. And
thank you for having me and partnering with Impactful Caregiving. It means a lot to
yes. Where can people find
that partners with you and believes in your platform?
Oh, thank you so much. We love our partnership with you. And if people want to learn more about how to take their certification course through Impactful Caregiving, where can they go?
Yes. So the platform is impactfulcaregiving.com. A lot of cool stuff there. You can sign up for my email list that gives you a caregiver to-do list. I have a podcast called The Care Pod, where I sit with thought leaders across this space. For certification, I will provide a 20% discount for Evergreen persons. Just email connect@impactfulcaregiving.com. Let me know you heard our conversation today and that you would like to begin your course instruction. And I will send you the code that's needed upon checkout. And be excited to have a conversation with you along the way with persons that have greater interest in these certification bodies, and ultimate outcomes will be beneficial both in clinical and personal practice.
Absolutely. And Evergreen also has a direct link to your site as well on our CGCP page as well. So if you visit Evergreen, you can get to Kiplee's course, or you can get directly to Impactful Caregiving to take the course to come through for certification. So we are excited to help you on your certification journey here.
Thank you so much. I appreciate your time.
Thank you so much for joining us.